Dr. Kapural, it's wonderful to meet you. I'm Ashley Reed. I'm one of the current fellows at University of Chicago.
Very nice to meet you, yeah. Thank you for having me here.
Very excited to interview you today and ask some questions about neuromodulation. The first one that I think they wanted me to ask were, what are some of the biggest challenges that you feel face neuromodulation at this point in time?
I think it's, number one is probably reimbursement right now. Some of the issues across the country, especially in some of the areas, like Southeast where I'm at, experienced some decrease of the reimbursement recently. And it's really unjust because of all of these advancements that we made in spinal cord stimulation, with improvements in functional capacity and pain scores, especially with the new therapies that we have today.
And do you foresee that getting better, you think, in the next couple of years?
I think so. There is lots of evidence on cost effectiveness on the spinal cord stimulation, and with the new therapies providing even better relief of the pain that we ever had, I think that's gonna kind of take care of itself.
Wonderful. Any other big changes that you see for spinal cord stimulation over the next 5 years?
Oh yes, I actually spoke about it yesterday a little bit, but I can see there are several new players in the field, lots of new developments when it comes to waveforms and new types of stimulation, but also I'm hoping indications as well. So you will see quite changed field over the next 3 or 4 years.
Absolutely. You guys talked a lot about habituation during your lecture time, and so I wonder if some of those new waveforms will make changes to what we're seeing for patients habituating from therapy in the future.
Yeah, everyone is adapting to it in order to be able to change or adapt or to even sequentially change waveforms when it comes to prospective follow-up of the patients. But I think the main changes are just coming with glial cell stimulation, with closed-loop stimulation, and some of the other new therapies that are just impressive when it comes to initial studies.
Absolutely. Is there anything in the field that you feel like is very misunderstood for spinal cord stimulation now?
Well, you know, the thought out there, expectations of the patients when they come to see you, is that spinal cord stimulation can treat any pain equally, and it's not. I mean, we have patients with predominantly inflammatory pain with very high expectations, and erroneously being trialed by less experienced physicians who only do a few of those a year. And the result is not as good as it would be if we pre-select the patients that are more proper candidates. So that's very important to address in the future.
Yeah. Is that something in your practice that patients that you feel like have an indication that is not as likely to be fully improved by spinal cord stimulation, do you set that precedent with them before the trial period?
Yeah, I mean, anybody has to do their homework, you know. The diagnostic blocks should precede any trial. Like, we have enormous number of the patients who have predominantly sacroiliac joint issues or lumbar facet issues and end up getting a stimulator before being even trialed with the diagnostic blocks.
And then anything from your talk, so your wonderful talk that you gave us yesterday, that you feel like you want people to take away from it mostly?
I firmly believe they're now heading toward this much better outcomes that we ever had before. We have potentially 4 therapies that will reach 80% of the patients with more than 50% of the pain relief. And that's going to be enormous when it comes to decrease of the opioid use, improvements in the functional capacity, and longevity of the pain relief that we don't see with other therapies that we do. So I think we are looking for quite a bit of use of the neuromodulation in the future with totally new therapies.
Absolutely.